Now let's turn to a moment of great importance for Europe's efforts to navigate this pandemic. Border controls have been lifted after 3 months of them being closed. And of course, the hope is that this has come in time to allow the summer holiday season to help kickstart economies across Europe. Today, all of these countries reopened their borders, either completely or with some restrictions on specific countries. Greece, for example, is allowing tourists from 29 countries, mostly from within the EU. That list, I should say, does not include the UK, Spain or Italy. So if you're watching in any of those places, you still can't go to Greece. Germany is fully opening its borders for travellers from the EU, although there are different advisories for each country. And France is opening its borders too. However, if you're coming from the UK or Spain into France, you have to self-isolate for 2 weeks on arrival. Well, let's stay in France because in Paris, cafes and restaurants have been allowed to let customers inside from today. Hugh Schofield's there.
I think in France today you really get a feeling that a stage, a period is coming to an end. Today, for the first time in 3 months, you can come to a bar or a cafe or restaurant, have a coffee outside or inside here in Paris. In a week's time, schools are opening across France, not on a voluntary basis as they have been up to now, but compulsory. Children will have to attend, and that'll free up a lot of parents to go back to work. And then on borders from today, that's opening up as well. For 3 months, France's borders have been tightly controlled, but those controls are coming down now, which means that the movement of goods and people can begin to resume. Is life going to be like it was before? No. Now we have masks, we have social distancing. A lot of people are still going to keep working from home. And above all, we have this severely traumatized economy, a 10% contraction in GDP or output, which means a lot of people losing their jobs, a lot of companies going to the wall.
From France to Austria, thousands of hotel staff there are going to be regularly tested for COVID-19 this summer. That's to try and reassure tourists, particularly those coming from outside of Austria. The aim is to test 65,000 hotel workers a week by the start of July. Bethany Bell has been to one hotel that began COVID testing in the Danube Valley.
The hotel is taking part in a pilot project aimed at trying to reassure tourists, especially those from neighbouring Germany. Every week, its staff is tested for COVID-19. The tests are run by the Red Cross and paid for by the government. Chaba, one of the waiters, says it's about safety for everyone, staff and guests.
That was an easy test, yeah. I think this is very important, yeah. This is what we have to do. And I think the Kirchenby Hotel does everything for the guests to protect our customers.
The government hopes to test up to 65,000 hotel workers a week by the beginning of July.
Well, we decided to offer this to the tourism sector because it's very important for Austrian economy, for the whole country, more or less, because it's very important to have also in this very special year as much tourists as possible.
Hotels who participate in the testing programme will receive a special certificate, which they can use for their websites and marketing.
Well, let's turn to the UK because cafes and restaurants certainly are still having to wait here, most schools too, but shops in England have opened for the first time since lockdown, albeit with social distancing in place. Bear in mind, Scotland and Wales still have non-essential shops closed, but for those who did open in England, there was considerable demand. There were even scuffles outside one shop in central London. Sarah Corker has more.
And the restrictions haven't put people off. Thousands waited for Primark to open in Bradford, Birmingham, Liverpool, and this is Bristol. The chain doesn't trade online and there's pent-up demand. On London's Oxford Street, there was a scrum to get into Nike Town, the crowd ignoring social distancing rules. And in Ashford in Kent, a steady stream of customers, but clothes shopping will be different.
Some of the clothes that you do try on, if you try them on, they're then quarantined. Some of the fitting rooms are actually closed, and brands are extending the returns policy.
But some retailers warn it just won't be profitable to trade with social distancing measures in place. The government say this is a phased path to recovery.
Now, many countries continue to struggle to keep COVID-19 under control. Let me update you on some of them. First of all, China, where the virus originated. There's a new outbreak of over 50 cases in Beijing, and it's being linked to Asia's biggest wholesale market. The market and 11 nearby neighbourhoods are now under lockdown. And this is significant because there have been no new cases of the virus for close to 2 months in Beijing. Well, this is the market in question. It's called Xinfadi. It's huge. Over 10,000 people work there, and it supplies 80% of Beijing's fresh produce. So that includes meat, seafood and vegetables, some of which come from China, some from abroad. To give you an idea of the scale of this, the market is bigger than 160 football pitches, and it's 20 times bigger than that market in Wuhan where COVID-19 was first detected. I should add, more cases have also been reported at a second market called Yuchuan Dongcai, which is several kilometres away. Now, Chinese officials are being ambitious. They want to test the thousands of people who've recently attended these markets. They believe the virus may have come from a chopping board or chopping boards used to cut fish. Here's an epidemiologist at the University of Hong Kong on that theory.
There's virus detected on this particular chopping board. It's not clear how it got there. They've also tested a lot of the meat, the fish, all those kind of samples. They haven't found the virus. So most likely the virus got on the chopping board from the person who was using it. We don't know where it came from, but we know there's always the chance for sporadic infections to pop up. Maybe an asymptomatic case who was infected elsewhere in China, traveled to Beijing, didn't even know he had COVID and spread it into this particular market. It does indicate the risk, whether it's after a week or a month, or in this case after 2 months after their last local case, infections will come back sooner or later. It doesn't mean that lockdowns are the best thing to do. They are very good for stopping transmission, but they're also very damaging to the economy. So not every country is going to go down that path again.
Well, the Chinese authorities are now vowing to avoid what they're calling a second Wuhan. Normally, we'd expect state media to be stressing the work that's being done, the good work in its view. However, some local Beijing media is taking a more downbeat tone, frankly. The Global Times is warning the risk of further epidemic is high. It quotes the Chinese vice premier, all districts and departments must not have any numb thoughts, war fatigue, count on luck, or take a relaxed mentality. And then there's the People's Daily, which quotes a spokesperson for the city authorities saying, Beijing has entered an extraordinary period. We should draw lessons from the pain, remain alert against the risk of the epidemic at all times, and resolutely cut off the spread of the virus. Other newspapers are simply urging people to wear masks. Here's more from the BBC's Stephen McDonnell in Beijing.
They're quickly mobilising people to be able to test tens of thousands of workers or neighbours near that vast market. All very impressive, the speed with which that has taken place. However, we've also seen the general manager of that market sacked, as well as a local party secretary. Other officials from the market have been called up to the local Communist Party Discipline Inspection Commission. Now, again, if you were to think, what might you do if you wanted to encourage a culture whereby cover-up is your first response? You know, where you might worry about openness and this type of thing. Well, you'd start sacking leaders anywhere where a small outbreak happened. And so for this reason, there's been some criticism of this handling of the matter because many ordinary people in China are even asking on social media, well, why is it their fault automatically?
Well, in a moment, we'll also update you on Pakistan and Bangladesh. First, though, India. Chennai is reimposing its lockdown on 15 million people. On Sunday, it recorded more than 1,400 new cases, and its total is now over 30,000. Local media is reporting that infections are surging in slum areas. On a national level, as we've reported on Outside Source before, India's eased its lockdown, but the threat from COVID-19 continues. New infections continue to spike, and there are over 330,000 reported cases. That's the world's fourth highest total, and India's death toll is close to 10,000. We also know that Maharashtra, Gujarat and Delhi are the worst affected states, and as you can see in these pictures, in Delhi, railway carriages are being converted into care centres, and there are broad fears the city's healthcare system may not be able to cope if cases continue to rise. Here's one doctor there.
Lots of patients coming to
our hospitals who are telling that they are not getting beds from last 3 days, 4 days. They have positive reports, but there's lots of difficulty to get beds. And once they get admission, then also our policies regarding admission, testing, discharge policies, everything are now in a developmental stage, means it's not properly made. So overall, there is a confusion at the point of policy making, and otherwise there is lots of patient load. Many patients are coming, and it's exhausting the existing healthcare system.
From India to neighbouring Bangladesh, it's one of the most densely populated countries in the world, and so it's particularly vulnerable to the virus. There are now more than 90,000 cases and 1,200 deaths have been recorded. And 2 weeks ago, lockdown was lifted. Millions of people went back to work. These pictures were taken during the lockdown. These are long queues for people trying to get a test, and all of this is fed into concerns that the healthcare system may not cope, and those concerns are rooted in the fact that there are just over 700 intensive care unit beds and the population is over 160 million. There's also a particular focus on the police. Over 7,000 officers have tested positive. What you're seeing here is quite a few of them doing yoga, something they hope will boost their immunity, though that's not proven. Here's one of them.
As the coronavirus spread, we tried to save our people. Our forces are now mentally healthier. Many were infected and the death toll is increasing, but now I think we can fight it.
Next, Pakistan. It's lifted its lockdown in early May when it had a relatively low 25,000 cases. Over a month later, it has another 120,000 cases. In fact, health experts are saying this virus may not peak until July or August in Pakistan, all of which is, of course, creating pressure. Here's the New York Times reporting people are being turned away from hospitals. Some hospitals even have signs saying they're full. And the anecdotal evidence is borne out by Pakistan now being in the WHO's list of 10 countries where COVID-19 is on the rise. In fact, the WHO is asking for the lockdown to be reimposed there, arguing it meets none of the criteria for lifting it. But the government's argument is that the lockdown was untenable for those living in poverty. Prime Minister Imran Khan favours local lockdowns around hotspots. He says that's necessary to ensure that the burden doesn't fall on poor people. Well, let's switch from Asia to South America and to more countries under pressure. A cathedral in Lima in Peru has been filled with the photos of over 5,000 people who've been killed by COVID-19. Local media is reporting that many weren't able to access adequate medical care, and that's symptomatic of the challenge in Peru. It has the second highest number of deaths, second highest number of infections in South America, in both cases after Brazil. Here's BBC Monitoring's Luis Fajardo on whether Peru's hospitals have the capacity to cope as the number of cases increases.
Clearly not, and that was the center of the criticism by a very influential voice in Peru, of course, the Catholic Church, and that powerful image of the cathedral in Lima filled with all the pictures of the people who died. Clearly, Peru is facing serious difficulties in meeting the challenge presented by the COVID-19 pandemic. And even though Peru was one of the countries that originally had been praised because of its actions, particularly in economic terms, they had started a very ambitious economic aid package to try to keep people in their houses, particularly from the informal sector, who in Peru, as in many other countries of Latin America, constitute a great majority of the working population. This clearly is not working enough. They are still facing great difficulties in this aspect.
And Luis, arguably the biggest COVID-19 crisis in South America is in Brazil. There's been a lot of controversy around President Bolsonaro and his policies and his comments. Where have we got to there?
Brazil, the situation seems to get worse and worse. It is now the second country, of course, in number of deaths and number of cases after the US, having surpassed many other countries. There was, you may remember a few days ago, a big controversy when the Brazilian government decided to change the way it was reporting the number of deaths and the number of cases, stopping more aggregate figures and having day-by-day figures. There has been a big legal dispute about it, and many other NGOs and other organizations are stepping in to make sure that the public realizes the degree of the crisis that Brazil is facing. Of course, it is also a country that is in a process of opening its economy, and many people are warning that with many of the largest cities in the world, like Sao Paulo, preparing to completely open their economy or open to a greater extent, the situation unfortunately can only get worse.
And Luis, I only have 30 seconds or so, but can you give me a quick update on Venezuela, please?
Venezuela is the big question mark in the continent. They report very, very low cases, but many people don't trust these figures as they think that the Venezuelan health system, as the economy in general, is facing great challenges, and it's hard to believe that the cases are so few.